Good day again, students. This is your instructor for understanding the self, Kenneth Alvin Cinco, for another lesson in our module 2. For this lesson, we will be tackling about a very important part of ourself, and that is our sexuality. So lesson 2.2 will focus on the things that are related to what we call the sexual self. So again, I would like to have a disclaimer. This lesson recognizes the use of discussions from the following books, no? All titled Understanding the Self with different authors. We have Corpus, Brenda et al. 2020, we have Ancheta. 2019, we have Alata et al. 2018. Um, for the purposes of brevity, I used codes in citing these three sources within this presentation. So if you see a code in the middle bottom of the slide that says C2020, I'm using the discussions on the book of Corpus Brenda. If you see also an A2019 code on the bottom center, you will see, well, I'm using there Ancheta, Ancheta's discussion from her book. And if I use 82018 on on the bottom center slide, I'm using the discussions of the book by Alata et al. And also for all the most of the pictures that I used, which I didn't cite the sources, are from pixels, and for the icons that I've used, I recognize them. I recognize and I cite them. They come from flat icon. And for other technical pictures, I post their sources uh, on the slide, so you just have to find the sources. Okay, so when we're tackling about the sexual self, it's a very important topic because number one, it's not um, well discussed openly, right? In Filipino society, we're still on the process of being open to discussions on the sexual self. So, according to Freud, sexuality is important, and matters about sex is very important because the behavior of a human being in sexual matters is often a prototype for the whole of his other modes of reaction in life. So for the psychologist Freud, what however we behave in our life is connected to our sexuality, whether we accept it, whether we have something beneath our sexuality, whether we're hiding something, or whether we are accepting of our sexuality, or whether we have uh, fantasies, or whether do we control these sexual pleasures or repress them. These are all a product of our reaction and uh, how we treat our sexuality. For this lesson, the sexual self is considered as an active dynamic structure that forms from organized perceptions on one's own qualities in the sexual domain into a cohesive internalized construct. So, what we will be discussing here are ideas that have been organized by scientists, psychologists, and all the people that have studied sexuality and the uh, reproductive system. The sexual self, as what we're discussing right now, the focus of this lesson, is defined as how individuals think and feel about sex in general, and feel about themselves as sexual beings. So, our sexual self comprises a complex set of schemas, meaning there are concepts, there are ideas or models, no, that allow us to understand and express ourselves as sexual beings. It's very much important that we know how to express our sexuality and how, of course, we identify and how we know about our sexuality. Um, for the outcomes of this lesson, after the discussion, the students will be able to, we will attempt to familiarize you with the concepts related to the sexual self. Second, describe the development of primary and secondary characteristics of sex. So how do we change, no? How does our sex changes through time? um, Discuss the operations of the reproductive system, because this is basically what we're talking about. Elucidate about sexual pleasures and erogenous zones. We also will be enumerating the human sexual response cycle. So this is basically an overview of coitus or sexual intercourse for those who are not familiar still with what of how the process of sexual intercourse happens. No? And we'll also tackle on the chemistries of intimacy, or in the book it's called Chemistry of Love. No? We will also familiarize about sexuality transmitted diseases and their prevention and reproductive health. This is one of the most important parts of this presentation, because this will be tackling about our health, a very significant part of ourselves. So, before we start, I have series of questions. You can just pause the video and try to answer this one on a rate of 1 to 5, from 1 being the lowest to 5 being the highest. How do you rate your level of knowledge about your own sexual identity and self-expression? So, where did you no know this aside from school? No, um, some of you may have attempted to discover your own sexuality through discovering it yourselves with your friends and your special someone. But um, is your knowledge that whole? No, I think it's not. No, so there are some parts that we still have questions with, and that we have to discuss, because as we know, Filipinos have this idea of veering away or going against discussions about sex, because this is still a taboo in our society. But well, we have to discuss this in our program, in our course, because if we don't discuss this as formally as possible, then there may be misconceptions, and it's very dangerous. No, this presentation will help us into clearing out misconceptions and giving us information about important matters regarding sexuality. Well, basically that's it. It's I've asked and I've answered the question, no, how important is sexual knowledge? Well, it's very important, but I also would like to know your ideas, no, so you can just, well, you can write on the comment section how important is sexual knowledge. So it's also a requirement for you. Please write on the comment section how important is sexual knowledge according to you. Personally, you can answer in English, you can answer in Waray, Cebuano, or Tagalog. Basta just answer, answer with everything that you know, and answer with relevance. How does people develop intimacy towards each other? Do you know this thing? What is intimacy? Intimacy is the act of getting close to one another, especially with your special someone. So, how do we develop that? Is it just a rapid process? I think not. It's a bond, no? So, do you have an idea how do we develop that? It's a good question that you should attempt answering. Most importantly, how does one maintain it? Okay? So, we start with the discussion. The sexual self is a multi-dimensional construct, meaning we get ideas from many fields, from biology, from psychology, from sociology, from anthropology. It's an idea with many sources. Multiple factors can affect other aspects of sexuality, such as sexual risk-taking behavior. So, sometimes there are people who risk themselves just to experience sex. There are 5 different sexual self styles of individuals. No, so when we're talking about individuality in terms of sex, it's not just that a person is readily readily prepared to have sex. No, we cannot do that. I know most of you don't know how to approach the discussion. That's why it's also important to know that there are sexual self styles of individuals. Number one, the sexual naive, no? Person who doesn't know about sex or doesn't want to approach, or maybe wanted to approach but has a difficulty in approaching it. We also have the sexually not assured, a person who is not assured with the discussions about sex, is not readily open, no? Maybe because there are reasons that may harm the identity of the person. There are also those who are sexually competent, those who do not need help. Well, they need help, but just a little, but they know already. It's like it's a talent to them, no? How to really get into the processes of sexual intercourse and the idea of their sexuality. We also have the sexually adventurous. These are people who, although they know, no, a little about sex, but they want to explore, and in exploring they learn a lot, no? And sometimes, well, the risk is there in adventuring about sex. This is one of the uh, parts where we have to be very careful with ourselves. Number five is the sexually driven. This is the person whose behaviors are motivated by sex. No, so um, according to academicians, there are five different self-sexual styles of individual, and knowing about these styles, we can know, well, we can identify with what kind of style do we have, no? Throughout adolescence, the sexual concept, also known as the sexual self, can be very unstable. That's why we're talking about it right now in this proper forum. Okay, so the self process has become particularly important in adolescence because adolescence is the developmental period. So this is where you are talking it. This is the stage where we are talking it in school because you are still in the process of knowing things, no? In which you cultivate more sophisticated understanding about your identity and the self. In this stage of your life where you experience puberty, romantic relationships, and most importantly, the ideas of your culture or culturally constructed norms, the sexual self is an important part of your development. So adolescents then has to uncover their authentic sexual self. You have to know uh, the information regarding the generality of our bodies and our reproductive system so that you will know more about what you need to know when it comes to sex, along with your sexual right as an authentic person. So do you know that we have sexual rights? So the World Association for Sexology shares the Declaration of Sexual Rights. Every individual has sexual rights. We have right to sexual freedom, right to autonomy or the right to decide for ourselves, our sexual integrity and the safety of our sexual body. We have the right to sexual privacy, right to sexual equity. We also have the right to our own pleasures and how we recognize and accept these pleasures. We have the right to our emotional and sexual expressions. We have the right to associate freely. We cannot be forced to have a relationship with those we don't want. No? We have a right to make free and responsible reproductive choices. We also have the right to sexual information based upon scientific inquiry, not just any information but validated by scientific studies. We also have the right to comprehensive sexuality education. And this discussion, this our class is part of that of exercising that right. We also have the right to sexual health care. Probably one of the most important part of discussing this uh, course. Now, to know more about our sexuality, let's first tackle what changes in us during adolescence. There are some changes when we encounter or when we reach the adolescent stage. First of all, we have types of physical change during puberty. There, we are we have two types. First is the primary sex characteristics. where we there is a change in our sexual organs or our reproductive system. And then we also have the secondary sex characteristics, where the viable changes that mark adult maturation, such as the changes in height and body shape, uh, take um, is happening, no? So primary sex characteristic change. This primary sex characteristic change happens, no, in our sexual organs. So for the women, there is a change, there is a growth, and you can feel some changes in your vagina, in your cervix, in your uterus, ovaries, and fallopian tubes. For the men, there is an enlargement of your penis, testicles or testes. You also can feel a change in the prostate glands, seminal vesicles during these ages, 9 to 14 years old. As you can see in the picture, you can see the parts of uh, the reproductive system there. Now, for the primary sex characteristics, what happens? The uterus for women starts to build a lining. This is an important part of the changing in uh, the reproductive system of women. The uterus starts to build a lining, no, that will be shed during menstruation. Vagina begins to produce mucus-like discharge, and you also experience what in scientific terms we call menarche, the first menstrual period. You have this already, I know. Lining, this period is where the lining is shed once every 28 days. What is this lining? No, as you can see, there's the part of the uterus, the very dark red one at the center. So there is a lining there. It forms there when you undergo this primary sex change. No, there is that lining which is in preparation for the uterus for initial portion of pregnancy, wherein the egg must attach to that lining. That is the importance of that lining, and you can feel it change if uh, you undergo the primary sex characteristic development. For men, we also have the enlargement of the penis, the testicles, the testes, the prostate glands, seminal vesicles. This usually occurs during 9 to 14 years. At it's completed between, sometimes there are people who completed on 12 years of age or 16 years of age. And then you have this first ejaculation, where in scientific terms it's called the spermarchy. So this is now the time where you experience your first wet dream, no? So it indicates that you, a boy, is now ready to produce the sperm. Now, when we talk about secondary sex characteristic, we're talking about the changes in your body, or the part of the body where it can be exposed to the public. No, these are viable changes that mark adult maturation, such as the changes in your height. No, for men, in puberty, sometimes um, well, women develop in childhood, women develop or become taller on childhood at a rapid rate. But for men, puberty um, pumps them up, and they uh, you know take height, no, they look taller, no, the change on the stage of puberty. In females, the breasts enlarge, no, the nipples erect, hair in public region, in pubic region, the hips widen. And for the males, there's growth of the reproductive organ, the body hairs, most especially. There's also the deepening of the voice and the increase in height. Now, let's tackle more about the human reproductive system. I know you already have tackled this in your well, in high school biology class, but we will be reviewing this one because we will be talking about how life, no, how life begins. So we'll be reviewing this one. So when we talk about the human reproductive system, it is a system of organs. So it's not just one organ, but a system of organs where it works together for the purpose of reproduction. the capacity of human beings, this is reproduction, the capacity of human beings to originate new individuals, that is reproduction. So reproduction occurs when sperm unites with egg, and the term fertilization occurs. So for the male reproductive system, the direct function is to provide male gametes, or what you call sperm. The spermatozoa, technical term for sperm, for fertilization of the ovum of the female, or the egg. So the sperm fertilizes the egg. So it includes the male reproductive system includes the penis, testicles. The testicles produces testosterone, a chemical or hormone that is very important for the male body. Urethra, you also have seminal vesicles, prostate glands, you have the bladder, vas deferens, and epididymis. So as you can see in the picture, those are the technical parts of the male reproductive system. We also have the female reproductive system. Um, it is composed of the ovary, uterus, the vagina, and you also have the cervix, the oviduct or the fallopian tubes, and the uterine lining. As you can see, the womb of the woman, um, it's the entrance is not just it's not where a child is conceived, no. The child is conceived in the uterus, but the entrance, the vagina, is where the penis is inserted in the process of coitus or sex. So um, the ovaries now produces the eggs, and the female sex hormones, which are called estrogen. If we have the testosterone for the male, we have estrogen for the female. This is responsible for the development of secondary sexual characteristics. Now, um, we discussed the secondary sexual characteristics a while ago, and that's the hormone estrogen is important for the development, no, of of the secondary characteristics of the female. So now we'll be talking about what reproduction means, what fertilization means. Our human reproductive system reflects the magic of life, wherein the male plus female equals fertilization formula is happening in sexual intercourse. A fertilized egg technically is called a zygote. A zygote is implanted in the lining of the uterine wall, and then a placenta develops. This is important for the oxygen of the baby, and then after that you have the birth. So this is the process of fertilization, no? From the zygote to the implantation of the walls to the to birth. As you can see here in the picture, you have here the egg which is transported here. We have the days, no? At day 0, you have the egg which is fertilized by the male sperm. You now have also the fertilized egg traveling in the fallopian tube. Day 1, you have the first cleavage appearing. And then for day 2, you have then the two cell stage, wherein the zygote is forming a shape like two pairs combined, and then you also have the four stage cell at day 3 and 4, and then you have the 8 cell uncompacted morolia, and then after that day 4, day 5, until on day 8 and 9, there is an implantation here in the uterus, and the lining, as what I told you, is playing the important role, wherein at day 8 and 9, you now have the implanted zygote, or what you call blastocyst, no. It begins the life already at the womb of the mother. That's why if you get pregnant, actually for the female students, no, and for also for the information of the males, you can um, discover the pregnancy. If you don't have a pregnancy test, you can surely know that a woman is already pregnant, uh, surely during the 7th to the 9th day, no, because this is where the symptoms of pregnancy, indications of pregnancy, are now appearing, no. So even without a pregnancy test, 7 to 9 days, you will know that a female uh, is now conceiving, That's probably because the blastocyst is now implanted in the uterine wall. They are now experiencing these indications of pregnancy, like vomiting, nausea in the morning, all of those indications. Okay, so that's the process of fertilization, or what we call the magic of life. Now we move on to our sexuality as human beings. So why do we enjoy sex? Okay, that's number one, no? Um, a while ago, the previous section, we already discussed what's the importance of the reproductive system as a part of creating human beings. Now, we will try to know what are these erogenous zones. We'll try to discover what are the sexual pleasures and these erogenous zones, which make sexual intercourse very enjoyable. No? Um, so, we'll be tackling what turns people on. When we're learning about our sexual experience, no, it comes it comes in the age of adolescence, this age where you are right now. No, our sexual pleasures now consists of positively valued feelings. It's very positive. That's why we like experiencing it. It's induced by sexual stimuli, which encompasses positive sensations. What are these sexual stimuli? We will discuss it later. It's rooted actually in the development in our mind of sexual fantasies. What are sexual fantasies? These are expression to sexual wishes that can't be satisfied. Sometimes our feelings towards sexual pleasure are heightened by our sexual fantasies. No, these are wishes that we cannot satisfy readily because society tells us not to engage haphazardly. Healthy sexual fantasies are healthy as long as they do not interfere with your social development. If you become very depressed because of your sexual fantasies, you become isolated or aggressive because of your sexual fantasies, that's not anymore healthy. That's why we do what we call this masturbation, or pleasuring ourselves with our genitals. So it's the safest way of experiencing orgasm, no, a safest form of sex. um, Okay, so what turns people on in the areas of our body? These are what we call erogenous zones. So these are areas of the human body that has heightened sensitivity necessary for sexual pleasure. So as you can see in the picture here, um, these are zones that light up more. These are the zones that light up when we experience sexual pleasure. No, those that are highlighted or with the light. No, these are the zones that you touch or you put stimuli on when you want to experience sexual pleasure. So, stimulation of these areas generates sexual response. This keeps you, or this heightens our sexual pleasure, these areas here. No? And these zones are genital areas. For a female, you have the vulva, the clitoris, the vagina. For the male, you have the penis, the scrotum, the perineum, prostate, and the anus. These are the erogenous zones. So, what happens? Skin receptors in the erogenous zones, on the surface of the erogenous zones, um, it flashes, no, it flashes information, and then it goes the information from the skin and those areas go to the brain, and then there's a positive evaluation from the brain, and the brain transmits nerve impulses back, no, to the body, and says that it's very pleasurable. Now the brain regulates the release of hormones when you are experiencing pleasure, when you're now experiencing this one. Or why are you experiencing this one? These are because of hormones. Now, when the brain releases hormones, it's part of the process of the brain. Number one, to recognize the pleasure. Number two, it's also to regulate what will happen with the body, no, um, uh, in the process of sex, no, and in the development of our sexual selves. It's believed to be the origin of sexual thoughts. So if we're talking about, sir, where do we find, no, the origin of our sexual thoughts? Why do we want to do this? It's because there are hormones, no, that plays a part. Uh, in our formation of our sexual fantasies. We will talk about that later when we reach the chemistry of love. So this is what the process of erogenous zone of turning people on happens. This process of our sexual pleasure. So what are these chemicals? No, the sexual hormones are very important because they play a vital role in our sexual motivation. No, we don't know why we have that urge. No, we don't know why we have that urge. It's because the body is actually telling us to reproduce. How does the body tell us to reproduce? It uses hormones, no? So, estrogen and progesterone typically regulate to engage in sexual activity. These are the ones that are released when the body wants to, when the body naturally, not just your mind, no, the body naturally wants to have that pleasure, and it pushes you, no, to reproduce. So these are the chemicals that are being released. Now, we also have this oxytocin. It's known as the hormone of love. This one is released during sex when orgasm is achieved. So what is the importance of oxytocin? It's also part of the it's also one of the hormones which are released when the mother is breastfeeding. It helps in maintaining a relationship because it's actually the hormone of love or the hormone of attachment. So when oxytocin is released, you feel more connected to your partner. It's actually like that, no? There are instances you don't consciously think about it, but it's what happens, no? The oxytocin is released. That's why the infant, no, the infant recognizes the mother, no, because of this oxytocin. They develop that bond because of this hormone. Well, you can teach a child that this is your mother, no. The child just knows because one of the factors is oxytocin. um Now, when we're talking about sexual pleasure, there are differences, no? There are differences depending upon our culture. So cultures have differences in terms of sexual pleasure. In every societies, there are sexual scripts which indicate what is valued and approved, no? Well, we know that there are societies which have arranged marriages. There are societies which are more open with their sexualities. There are societies which value more intimacy and social relations more than the sexual pleasure. Majority of people in a social group preferred sexual activities that conform to their culture. So if you are thinking about your sexual pleasure, it's actually also informed by your culture. So don't be culture shocked when you go to other countries and then you experience, no, there are differences in the sexual culture. It's just that, no. In traditional societies, sex may be taboo, no. The topic of sex may be taboo. In Greece, there are other topics of sex. Monogamic societies, no, are also different in one another. In different countries, monogamy are practiced, no, sometimes differently, and culture also dictates that societies practice polygamy or marrying, no, many partners for the male. So monogamy is marrying one partner. Okay, religion also plays a role in our view of the sex. So whatever we think about the sex, it's influenced by these factors, no, cultural factors. Whatever we think about our erogenous zone, sometimes it differentiates because of culture. But sometimes, no, most of the time, usually, sexual pleasure is just, the body. We all are people, but sometimes it's colored with our culture. Now, we ask, sir, how does coitus happens? What is the process of coitus? What is the process of sexual intercourse? So, it's the human sexual response cycle is composed of four phases. Okay, sexual intercourse is composed of four phases to culminate, no? There are four-stage model of psychological response to sexual stimulation. It's formulated by William H. Masters and Virginia E. Johnson in Human Sexual Response. This is written in 1966. There are four phases. We have the excitement phase, the plateau phase, orgasm, and the resolution phase. This is the typical, no? Why am I talking about this? Because for you students, you have to know what happens during sex. It's not just, pack and then that's it. So these are the things that happen. No, these are stages. So the first is the excitement phase. Of course, it wouldn't be sex if it wouldn't be exciting. The first phase is the arousal. You have your partner, you have you get physical with each other, and then there are stimuli that are being moved, no, are being influenced. It can last a few minutes to several hours. Sometimes um, there's an increased muscle tension, quickened heart rate. No? The excitement phase is what you call the foreplay. There's always a foreplay. No? This is where the partner moves towards each other. Blood flows to the genitals, lubricating fluids began to show. So don't panic. No? In the excitement phase, lubricating fluids began to show. Then next is the what you call plateau phase. This is the process. This is the longer process, no? This period of sexual excitement prior to orgasm. This is now your activity. So this is now a rigid activity, plateau, no? So increased circulation of blood and heightened heart rate. This is what happens to the body. The vagina continues to swell from increased blood flow while the clitoris becomes highly sensitive. And well, the penis hardens, no? And then the partners do it. Then orgasm. This is the conclusion of the plateau phase. This is the climax of the sexual response cycle. This is the top most of the pleasure. Sir, is there an orgasm for the female? Yes. Females do have orgasm as well as males, no? So this is the shortest of the phases because this usually is the where the partners disengage with each other, no, begin to disengage. It's accompanied by quick cycles of muscle contraction in the lower or pelvic muscles. Okay, it's sudden forceful release of for the male it's the spermatozoa, no, and then a release of hormones. Then the resolution phase. This is the fourth phase. Okay, it allows the muscles to relax, blood pressure drops, slows down from excitement. So because that it's the is already released, no, marked by general sense of well-being and often fatigue. So this is one of the gifts of sexual pleasures, no, the ability of the body to recognize that there is relaxation after physical activity, which is sexual intercourse. And then some women are capable, some women are capable of rapid return to orgasm phase, or what you call refractory period. So sometimes a couples, no, you can have these phases, these four phases repeatedly, or in layman's term, you can have rounds, no. So it depends upon the ability of the body. For some women, they have this very amazing orgasmic cycle, no. Okay, so what happens with the chemicals of our body when we're doing sexual intercourse, no? The chemistry of love, no, these are the operations of the brain, no, when it comes to uh, triggering us with feelings, no, of saying that we're feeling in love, or we're feeling this sexual connection with each other. So there are actually chemicals in our body that pushes us to do it, no. Love is the foundation of human existence, but some scientists say that it's chemicals, no? When a person falls in love, the brain manifests some changes and certain chemical compounds are released. Prof. Helen Fisher suggests that there are three emotional systems. No, one is lust, attraction, and attachment. They mediate mating, reproduction, and rearing the child. They are the ones responsible for our feelings in reproduction. No, each associated with different collection of behavior. So we behave differently um, when we experience these emotional systems. We start with the sex drive or libido or lust. No, this is the emotional system where there is extreme sexual attraction to the object of affection. It's driven by these hormones, that testosterone in men and estrogen in women. So when you feel that sexual attraction, that very strong sexual attraction, you're driven by these hormones. This pushes individual to seek sexual union with any appropriate partner. Next, emotional system is the attraction system. You have passionate love, obsessive love, or infatuation. No, this maybe is before no your last. No, you begin with the attraction system. No, you feel infatuation, increased energy, focusing on preferred mating partner. These are the hormones which push you to find no crushes, attractiveness. No, it's pushed by these chemicals. One is dopamine. Dopamine is responsible for motivation, reward, pleasure, goals. These are released when uh, you experience a reward. This dopamine is released when you experience a reward. Like for example, when you win a game and then you get praised by your colleagues, or you get um, hugged by a special someone. Dopamine lets the brain feel pleasure. That's the role of that. You also have norepinephrine, extra energy, or adrenaline. This explains why you feel agitated when you look at your crush or somebody teases you that your crush is here. Your blood is rising. That is the work of norepinephrine, or adrenaline also. Serotonin decreases because of obsessive thinking. Your serotonin is one of the happy hormones. It decreases when your adrenaline rises. No, so these are the hormones, or the chemicals. No, I can call them chemicals that react with each other when you experience the attraction system. The next one is the attachment system. Attachment system. This happens when you're already physically with the one you love, no, or the loved ones that you have. This is what you call compassionate love. It's calm. It's security. You can feel social comfort, emotional union, wanting to make a more lasting commitment to a loved one. It pushes you to do this or to feel these things. No, it's driven by oxytocin. That's what we discussed a while ago. It's a trust hormone. This also explains why a child only feels secure with their mother. No, it promotes monogamy. Sometimes the oxytocin of people only matches a person. So it promotes monogamy. So some academicians say that this is the root of monogamy. When in fact, in the animal world, it's not just monogamy, no. Some mammals have a lot of sexual partners, but for some academicians, they say that oxytocin promotes monogamy. We also have vasopressin, which helps in turning a male into a nurturer. So as we can see, some males, no, feel this need to take care of their family. It's also driven by this hormone. Okay. So these three emotions, lust, attraction, attachment, they act in concert with each other and with other bodily systems as well. And they also act independently as well. So these emotions are driven by chemicals. Now, the next question is it only male, female? No. Sometimes we also identify with uh, our attraction identifies, no, with other or with the same sex, no. So we'll talk a little about sexual orientation. So in adolescence, it's a time of transition for the parents, for the person and the parents. Sexual orientation is a lasting pattern of romantic or sexual attraction. In adolescence, you're starting to know your sexual orientation, no, to persons of the opposite sex, same sex, or both sexes. So sexual orientation basically talks your sexual attraction and your patterns of romance, no. um, a sexual orientation also refers to a person's sense of identity based on sexual attractions, behaviors, and membership in a community of others who share those attractions, no. Okay. Sexual orientation, you have basic identity labels. So, for you, students, what's your sexual orientation? Your sexual orientation is basically your identity label. Number one, basic, you have a heterosexual basic identity label. This a heterosexual is physically, romantically, and emotionally attracted to individuals of a gender other than his own. So, if you're male, you're attracted to a female. Hetero meaning varied, no? Um, Other sexual orientation is also homosexual, one who is physically, romantically, and emotionally attracted to individuals of the same sex. Like, for example, lesbian, women attracted to women, and gay men, men attracted to men. Basically, these are the basics, either heterosexual or homosexual. We also have other categories. Sometimes we have bisexual. These are men or women attracted to both sexes. And we also have asexual, people with no desire for sex. Yes, there are people with no desire for sex. What happens there? Because sometimes there is an imbalance of the hormones, no? But it's not just the hormones. Maybe some people choose to do so, no? Like, for example, priests, no? They often become celibate or monks, no? They're asexual sometimes. Some of them are asexual. Now we go to the sources. Well, no one knows what is the cause of heterosexuality, homosexuality, bisexuality, asexuality. The Royal College of Psychiatrists in 2007 claims that there is no substantive evidence to support the idea that the nature of parenting or early childhood experiences plays any role in the formation of a person's SO. We are a bit hazy about these things, okay? So, what's the source? We're a bit hazy about these things. We can just theorize, no? So sometimes it appears that sexual orientation is biological in nature, so determined by a complex interplay of genetic factors and early uterine environment, or in the mother's uterus. There are studies that say that what happens in the mother's uterus can also play an important part in determining your sexual orientation in the future. So the hormonal theory of sexuality holds that hormonal exposure also influences the social orientation that emerges later in the adult. So maybe some hormones, no, are exposed to you, some hormones are exposed to people, and it influences how they become in their later stages. So the internet also, socially, the internet has influenced sexual orientation in two ways. So it is common mode of discussion in the subject. It's very common in the internet to be talked about and sexual identity, and therefore it shapes beliefs of people. No, we human beings are imitative people, and sometimes they are tawag dito, they imitate people and they become those people, idolize people, and like that, no. And it allows anonymous fulfillment of sexual partners. The internet allows anonymous fulfillment of sexual partners. So in the internet, you have all your fantasies there, no. Sexual partners you can get anywhere from the internet, so as well as facilitates communication among a greater number of people, so it reinforces our sexual orientation. Now, we move on to sexual health. This is one of the topics that I would really like to, I'd really love to share with you and to really, really strongly discuss with you. When we talk about sexually transmitted infections, well, first of all, sex is not just all pleasure, no? Because it's part of our being human, it's a physical process, there are dangers. So you have to be very careful with your body, no? Because attachments may lead to certain STIs. So what is an STI? STIs or STDs, sexually transmitted diseases, are infections that are passed from one person to another through sexual contact, including vaginal, anal, and oral sex. So uh, you can't say that it's just vaginal. No, if you do another things, even physical contact, you can pass STDs or STIs. But just some, not all. It's not curable. It's not that. It should not be a cause for discrimination. Okay. Some are also spread through non-sexual means via blood or non-blood products. So there are also those transmitted from mother to child during pregnancy from childbirth. This is the most hurtful thing, no, in sexually transmitted diseases, because the unborn child could be harboring virus or infections that were caused by your inappropriate sexual or accidents, no, sexual activities. So what are the reasons? Unprotected intercourse, that's one. That's why you should practice safe sex. Practice safe sex. No? Blood transfusion. That's why you have to be very vigilant when you're doing operations or you're in the hospital. No? With your blood, you should give your information accurately as possible to the medical personnel. And your medical history should be revealed as accurately as possible. And you should also check, no, the cleanliness. You should be aware of the cleanliness and the procedures, no, when you're doing blood transfusion. Okay? Needle use. Basically because these infections are blood related or related to our blood. Pregnancy. Okay, the unborn child is very helpless. They don't know that you have passed them your disease. Okay, so what are the symptoms? A person can have STI or sexually transmitted infection without having obvious symptoms of disease. But there are basic in the picture. Number one, you have painful urination. You have to let the doctor check you. You have bad smelling discharge. You have to let the doctor check you. You have painful intercourse, not just because the penis of your partner is large, but there is something that is very much uneasy in your sexual organ. You have to check with the doctor. You have unusual penile discharge, yung tulo, no, that you cannot explain. It's not fluid, it's another type of fluid. You have to let your doctor check you. So common symptoms of STI includes these three: vaginal discharge, urethral discharge, burning in men, genital ulcers or mga tawag nito paso-paso, no? Paso-paso in your genitals. Abdominal pain, this is one of the most easily felt. So STDs are caused by bacteria, yeast, or parasites, no? But it can be treated sometimes by antibiotics. However, there are STDs which are hard to cure. Okay. So next, no cure for STDs that are caused by virus. But medicines can help control lang the symptoms. That's why you should be very careful. But because there are no cure for STDs caused by viruses. So what are the risk factors? When do you get, no? Okay. When what are the factors that could increase your risk, no, of having an STD? Number one, when you're not using barrier protection, when you're not using sexual protection. Number two, history. If you have a history of STI, okay, that could be one of giving you more risk in having this. So if your age is between 15 to 24 years old, this is fun time for sex, but it's also the most dangerous time. So you have to be very careful. Alcohol and drug abuse, very very careful. Um, Especially alcohol and drug abuse. This is peer pressure. You shouldn't give in to this one. Sexual intercourse with multiple partners. This cheating in a monogamous culture, naku, it's very detrimental to you. If you have one sexual partner, stick to that. especially if you don't know the history of your new sexual partner, it will become a danger to you. Now, STIs like herpes and syphilis can increase the risk of HIV. So we're now going to HIV. What's HIV? It's a human immune deficiency virus. When the body has an immune deficiency, it's very dangerous because your immunity, the body's immunity, when it drops, you are vulnerable to many sicknesses. So you have to be very careful you don't have that you won't acquire HIV. So these are some of the symptoms. Now if you have HIV, you have fatigue, you have sore throat, you have diarrhea that is unexplainable. No, you didn't eat something, but you have diarrhea. You have night sweats, you have muscle aches, you have rashes. This one of the symptoms which are not confused with others. No, fever and chills, swollen lymph nodes, and mouth sores. When you have this, it's HIV. No, you have an infection. HIV can be found in the uh, where can you find this virus? In the semen, in the blood, in the vaginal and rectal fluid, and breast milk. That's why it's sexually transmitted. No? Because these are the these are the parts that uh, can transmit, no, the virus. HIV can be transmitted also through blood to blood contact, sexual contact, childbirth. This is again a very, heart wrenching part of having an HIV. Breastfeeding, the sharing of equipment. No, that's why sometimes your parents or your someone special to you would really say that you have to be careful with the needles because this equipment can be the transmitters of the virus. It needs to be treated. Why? Because it can progress to stage 3, which is technically no return disease, no, autoimmune disease syndrome. So it's AIDS. So you have to be very careful because if it's autoimmune, your immunity is really compromised, no, and it cannot be reversed. It's hard to reverse it. There are researches right now that are trying to cure AIDS, but I don't think they will be publishing their success stories with their attempts or the scientists' attempts to cure AIDS because there could be some dangers. No? But let's just hope that the cure for AIDS is at hand. Okay, we go to sexually transmitted diseases. Now, in the picture, I lifted this up from a medical source. No, in the picture you have there syphilis, gonorrhea, trichomoniasis, chlamydia, cancroid, genital herpes. So you can see there that it affects the genitals. No, for syphilis you can see for syphilis is one. You can see painless open ulcers, mga paso-paso, no, in the genitals. But actually for syphilis, these ulcers and the rashes covers the body. No, you in gonorrhea, you have here. Uh, why did I show you these pictures? Because um, to know that you already have this one, the easiest way to determine is to look at your genitals, and if you have this one, well, you should visit your doctor. No? Ah, thick yellow discharge. Oh, this is the cervix for the female. No, in your vagina. If there is a thick yellow discharge in the cervix, there's gonorrhea. No, it's tulo. No, trichomoniasis. This is also a heavy yellow green. No, discharge or gray discharge. Um, for chlamydia, there's also an inflamed cervix. So your cervix are inflamed. No, there are tawag dito, swelling in the cervix, the entrance to your uterus. For cancroid, there are open sores. No, itong mga hubag-hubag na may nana. So swollen groin. If your groin does have bulges a lymph node, it's a cancroid. And we also have genital herpes. This one, it has cluster. If you look at the vagina, it has a cluster of fluid filled blisters. There are blisters there, and the blisters, yung mga paso-paso lagi, may tubig na ang sulod. Okay. So, you can read this one, no? What is an STD? So, an STD is a sexually transmitted disease. Uh, something you get from another person either by vaginal, oral, or anal sex. Now, we will have to know what are the symptoms, no? Let's start with HPV. It's human papilloma virus. It is a common viral infection, no? HPV. This one, HPV. It's a common viral infection, no? Sometimes called common cold of STDs. Sometimes this is very common. How do we test this? Women over 21 tested every 3 years by pap test. Now, women age 30 to 65 tested every 3 years by pap test. So, for women, you can do pap test, no? Symptoms. What are the symptoms? It is hard to detect because there are no symptoms. This is very important, except in the strains that cause genital warts. So, treatment, there is no cure if you get HPV, but many people will clear the virus within a year. Those that don't are at increased risk of cervical cancer. So, it is very important that you stay current with your recommended screenings. You should screen yourself, no, for women. Prevention of the HPV vaccine is key. So, if you have the vaccine, it's good, no? Girls and boys should be vaccinated starting at 11 years old. So, gonorrhea and chlamydia. In early stages, there are no symptoms. Gonorrhea and chlamydia are both bacterial infections transmitted by bodily fluids during sexual intercourse. So, what's the testing? For women, it's less than 24 years old. For women women more than 24 years old, women less than 24 years old with risk factors, you have to test. 24 years old and lesser than 24 years old but with risk factors, you have to test. So, symptoms: bleeding after intercourse, pelvic pain, yung sakit sa dito sa hawak, no? Vaginal discharge, yellow or green with a foul odor, pain during sex. So, how do you treat this? Antibiotics. It is critical that you and your partner complete the course of treatment. Kayong dalawa ng partner mo, kasi baka yung partner mo meron na din. Okay, or siya yung source mo. So, the two of you should tawag dito, should be checked. Syphilis. Syphilis is a bacterial infection. So, it was once on decline, but it is now becoming widespread. Historically, syphilis was incurable, and it was a disease that even the nobles, no, have, and they were very afraid of this one. Now, it came back, no, nawala na ito, but it came back. Testing. So, how do we test? Testing is recommended for pregnant patients and those with significant risk factors. So, what are the symptoms? First stage, painless sores. Meron kayong mga paso-paso, no? Painless sores. Second stage, lesions in mouth, dito. Rashes spread across the body. Swollen lymph node, yung mga may mga lymph node kayo, may mga parang mga maliliit na seeds kayong nafe-feel sa ano. Pag yan lumalaki, no? It's second stage of syphilis. Third stage, manifestations in skin, both cardiovascular and neurologic system. How do you treat this? Antibiotics. Later stages of syphilis are more difficult to treat, so early detection is key. You have to be checked as early as possible. Now, these are examples, no? So again, for sexually transmitted disease, the picture that you're seeing here is a medical picture that shows you what happens for the woman to the vagina, no? This is just an example, no? So, in genital herpes or herpes simplex virus, it affects the skin, cervix, genitals. It not only for the woman but also for the man. It's easily transmitted through direct contact. We have here symptoms. These are the symptoms. One of the symptoms, no? External genital area, rectum, blisters, ito na, thighs, buttocks, vaginal discharge, pain on urinating, fever, and cold sores around the mouth. So those are the symptoms. Syphilis. Look at those, no? I intended for you to look at this one so that you can be aware, no? And you can uh, assess your level of, you know, your level of awareness about what happens, no? If you can see people with this one, tell them, no, to get checked. Syphilis is caused by bacteria transmitted to sexual contact, as we discussed. Now, pregnant women can also pass this STD to their baby. Okay, we move to the next one, chlamydia. So, how does chlamydia affect the body? Number one, you have flamed eyelids. These are the symptoms. Inflamed eyelids, mga mata, inflamed na yung mata, no? Abdominal pain, these are very common symptoms of chlamydia. You also have vaginal discharge or bleeding, discharge from penis, may tulo. You also have painful or swollen testicles. You also have anal discharge or bleeding. Pag pupo kayo, may bleeding. So, burning during urination, nausea, nahihilo, fever, no, lagnat. So, if you see uh, these symptoms, you should get tested, and maybe it's for chlamydia. So, caused by bacterium chlamydia trachomatis, most common bacterial STD. A person who does not receive treatment for chlamydia may experience pelvic pain, painful sexual intercourse, bleeding between periods. So, we move on to the next one, gonorrhea, no? So, what is gonorrhea? It's caused by a bacterium that usually attacks the mucous membranes. A bacterium that thrives in warm and moist cavities of the body like the vagina, penis, mouth, rectum, or eyes. That's why in gonorrhea, sometimes the eyes are also affected. Pregnant women can pass this infection to the infant again, no? Um, if left untreated, females may develop pelvic inflammatory diseases. You experience the pain in your pelvis, no? So you may develop diseases if you still continue with this one. So, how do we prevent sexually transmitted infections? No, there are tips. Okay, tips to lower your risk of developing a sexually transmitted infection are number one, abstinence. No, these are tips. You can read it there. You can read it in the image. So, basically, you have to get counsel and behavioral intervention with professionals, psychiatrists, and medical professionals. You have to get your sex education. You have to reduce your risks, the risks that we discussed. No, if you're getting sex, be protected. No, you have to use the condom and promote adolescent counseling. No, this part of our uh, lesson, this is one of the uh, mandates, no, for us to discuss sexual health. So, how do we prevent? Abstain from sexual contact, either vaginal, whatever. Just abstain from sexual activity. You can also take birth control pills to prevent, and be monogamous. My God, don't play with others. Just, if you have a relationship, stick to that. Okay, self-care interventions for sexual and reproductive health. This is brought to us by the World Health Organization. So uh, how do we easily, um, protect ourselves? Number one, you should self-test. Uh, you have pregnancy test. Ovulation predictor kits may help you in your testing and self-management of abortion, HPV self-sampling. These are interventions in our controlling our HIV and STDs. Okay, another part of the danger, no? Why sex is not just pleasure, but societal also. It affects our society, no? Because we have this problem of unprotected sex, no, doing, no, going with your sexual pleasures with many people, no, may not just give you sexually transmitted diseases. It would also, you would also contribute to a certain social problem, no, which is teenage pregnancy. I know you are adolescents right now, so it's very relevant to discuss about this one. So it's also known as adolescent pregnancy, uh, where the females are pregnant under 20 years of age. So for her healthy females, 12 to 13 years, you are already ready for pregnancy. Teenage pregnancy, um, sociologically, how is it a problem? Number one, it is caused by lack of education and information about reproduction. So that's number one, why we have teenage pregnancy. So if we didn't discuss this one, maybe you'll also be one of those who will be a teenage bearer of a child, no? Your peer pressure is also one of the causes. Early engagement in sexual activity because of media, because of your rebelliousness, which you can't control. That's why we're studying understanding the self, because we need to know more about the things that push us, that we had a choice to control, no, one of that is our sexual fantasies and our sexual pleasures. So teenage pregnancy usually comes from families of low socioeconomic status. It is linked to low level of family connectedness, no strong role models. So for those people who have households with low socioeconomic status, no, you have to be careful. If you know that your family is not that connected, you don't converse, especially with topics that are relevant, no, like this one, no, sex is a relevant topic, so you should share your problems with your parents, no. So you have to find people who you can be comfortable with and who are not joking, no, with topics like this. So, teen mothers, this is very impactful to teen mothers, no? They are very likely to drop out of school. This is now the consequence because of low ambitions and dedication to getting education. We know this, no? We know this. We see teenage mothers, no, dropping out of school and giving up on their dreams. They are forced to become, you know, unemployed. They rely on their families. No, teen mothers may be subjected to violence. This is now why it is a social problem, because most of teen mothers, no, because they don't have the strength, their strength is now used to the nurturing of their child. They can protect themselves. No, they are susceptible to violence and unable to develop a complete sense of identity because they have this new role. Now, in another light, we don't have to be hopeless all the way. Now, what can we do? So, some factors increase the likelihood of making these teens become more suitable for parenthood. We just have to support them. They can gain strength through support, no, of parents and favorable social support of peers. What kind of support? We should also educate them. No? It's not just, supporting financially with just without giving them the right education. No, you have to educate them that to not make the same burden in the future, you have to undergo what must be discussed. That's why trustworthy adults to confide with are important. If you have friends that are uh, uh, teenage mothers, you have to reach out to them. No, teen mothers need to be supported for their children to grow up having a positive self-image, unconditional love and support. Let's not add to the burden. Why? Because this is a societal problem that is very burdensome, no, to not just financially but psychologically for mothers. That's why, our society have passed the reproductive health law. And in the reproductive health law, it is indicated the processes of contraception. Now, we know that the problem of overpopulation plagues the Philippines. That's why the senators and our legislation have passed the Responsible Parenthood and Reproductive Health Act of 2012 is to address this issue. What does this law have? It guarantees the methods and the information on the universal access to birth control and maternal care. That's what the Reproductive Health Act has, no? So in detail, it allows the usage of contraception methods. We're going now to contraception. So this is the law that states that it's allowed, no? Even if the Catholic Church will say it's not allowed, it's in the law that we can use, no, contraception methods. So other elements of this law includes family planning and information services, no. You should read this law. It's also concerned with maternal, infant, and child health. It's also concerned with the prevention of abortion, prevention and management of RTIs and STIs, the diseases, no, that is linked to sex, elimination of violence against women and children, gender-based violence. Because we know the teenage mothers, no, and adolescents are susceptible, are vulnerable to abuse. So, contraceptives are essential. No, it's a staple of the RH law. Contraceptives are products. What are these? What are these things? No, no, contraception. No, it counters the conception of the child. No, contraceptives are products used by male and females to prevent pregnancy. There are natural and artificial methods, and we will discuss it. So, some of the things that you can see are what you call short-acting contraceptive methods. No, this one is ranked by effectiveness. No, as you can see, your condom is not that effective actually. Okay, let's go over some. No, we first start with the natural method. Number one is abstinence, not engaging in sexual activity. It's the number one natural method because it is the most effective. It's also the most difficult because naturally people are inclined towards sexual activity and sexual pleasures, but it's the most effective method to not have uh, a baby, no. Another one is the calendar method. This is what you also known as the rhythm method. um, it means no sex in fertile days. No, if what calendar are we talking about? Is it January, February? No, it's um, the rhythm of the women's menstruation. Women's menstruation indicates if the woman is fertile or not. So women likely to conceive 3 or 4 days before and 3 or 4 days after ovulation. So you don't engage in sexual activity during these days. That's why it's known as the rhythm method. There are days you abstain from sex, there are days you are free to have sex because you have the rhythm. So partners should accurately monitor the monthly cycle if you're using this kind of natural method. But it's dangerous actually sometimes because there are females who are irregular in their menstruation. So you have to really know when. Okay, so there also what you call coitus interruptus or withdrawal method. This is one of the oldest methods, no? It involves the man withdrawing his penis at the moment where he ejaculates during sex. So it means that you don't let go of your sperm inside the vagina or the cervix, no? So um, the disadvantage is that pre-ejaculation fluid, the fluid that comes before the real ejaculation of the sperm, no, contains a few spermatozoa. For your information, so it's still dangerous. You should use other contraception. You can use artificial methods. Now we're starting with artificial methods. What are some of these artificial methods? Number one are oral contraceptives. These are what you take and uh, for the women, no, aka birth control pills. So they contain synthetic estrogen and progesterone. Estrogen suppresses the follicle stimulating hormones, the follicle somewhere in your ovary, and the LH2 prevent your ovulation for the women. So the women will take the first pill on the first Sunday after the beginning of the menstrual flow as soon as prescribed by your doctor, or just ask your doctor when you will take this one. So this will help how does the oral contraceptive or the birth control pill help you not to conceive? It takes part, it happens through chemical stopping your, affecting your natural operations of your body. Another one is the transdermal patch. It contains both these hormones, estrogen and progesterone. So what do you do? Women should apply one patch every week for 3 weeks on either upper outer arm, upper torso, abdomen, or the buttocks. So on the fourth week, no patch is applied because the menstruation will occur. The area where the patch is applied should be clean, dry, and free from irritation. The next one is the vaginal ring. As you can see here, the vaginal ring is inserted in the vagina. It's shaped like a, well, it's like a ring. That's why it's called a vaginal ring. It releases the combination of estrogen and progesterone, and it surrounds the cervix. No, this silicone ring is inserted into the female reproductive organ and remains there for 3 weeks, and then removed on the fourth week. So, as menstrual flow would occur, the woman becomes fertile as soon as the ring is removed. No, so another one is subdermal implants. It's two rod-like implants inserted under the skin of the female during her mens or on the seventh day on her mens to make sure that she will not get pregnant. This one, you actually insert it under the uh, arm. Implants are made with uh, etonogestrel, desogestrel, and progestin and can be helpful for 3 to 5 years. Another one, letter E, is our hormonal injections. So, a hormonal injection contains progesterone and progesterone, usually given once every 12 weeks intramuscularly. It's injection. No? The injection causes changes in the endometrium and cervical mucus to help prevent ovulation. So your mucus, if you inject this, there's something happening in your mucus so that it will not help in the ovulation. uh, Intrauterine device or the IUD, as we saw, one of the most effective methods, no? IUD, this is the IUD and how it is implanted in your uterus. So it's a small T-shaped object containing progesterone that is inserted into uterus via the female reproductive organ, and it prevents fertilization by creating a local sterile inflammatory condition to prevent implantation. So meaning, uh, the implantation of the blastocyst or the zygote is prevented. No, as you can see, there is a barrier there. So fitted only with the assistance of the physician after the menstrual cycle. So you visit your doctor if you want to be uh, attached with an IUD. It can be effective for 5 to 7 years, but just ask your doctor. So another artificial methods are chemical barriers. We have here spermicidal foam, or a foam which kills the sperm. No, you have their spermicides, vaginal gels, and creams and glycerin films are used to cause the death of sperms before they can enter the cervix and to lower the pH level of the female reproductive organs, so it will not become conducive for the sperm. You can ask the doctor before having this one, because sometimes maybe there are adjustments on the pH level before you are safe to uh, apply this one. So these chemical barriers still cannot prevent STIs. Okay, when you just put it there and then you still have sexual contact with a person with an STI, it will not help you. Okay, another artificial method is the cervical cap. This is a cap that you put as a barrier on your cervix, no? So it's made of a soft rubber and is fitted on the rim of the cervix. As you can see here, no? It's not on the vagina, it's on the cervix, no? It's on the entrance of the uterus or the womb, no? It is shaped like a thimble with a thin rim and could stay in place for not more than 48 hours. Another one, the most popular, is our male condom, the condom for the males. So it's latex or synthetic rubber sheath that is placed on the erect male reproductive organ before penetration into the female RO to trap the sperm during ejaculation. It can prevent STIs because there's no skin to skin touching and can be bought over the counter. Out of all these things, out of all the contraception, this is the one that you can buy over the counter. It even has in 7-Eleven or in the pharmacy. No? Ideal fail rate is 2%. Typical fail rate is 15%. So there are fail rates. It's actually ranked one of the least effective methods. Why? It's due to a break in the sheet's integrity or spilling of the semen. Sometimes it tears apart and the semen still goes out and goes into the cervix. Another one, if you don't know, there are what you call female condoms. These female condoms are also made of latex rubber. It's sheets that are pre-lubricated with spermicide. So as we review the other contraception, you also have the spermicide, in this female latex rubber condom. So it's usually bound by two rings. The outer ring is inserted against the opening of the female RO and the inner ring covers the cervix. So it's like a cap and a condom. So it is used to prevent fertilization of the egg by the sperm cells. So one of the last methods are the surgical methods. This one needs the expertise of a surgeon or an OB-GYN. So for the male, you have the vasectomy. It creates a small incision made on each side of the scrotum. So here, as you can see, the scrotum is the 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 tube here is cut. No, so vas deferens is tied. No, this one it's tied like that or cut. No, are plugged to block the passage of sperm from the scrotum. So the sperm from the scrotum will not anymore reach the prostate gland and go outside the urethra. So patient still advised to use a backup contraceptive method until two negative sperm count results are recorded. After you get an operation, you still have to be very careful because sometimes it may not no um, it may not affect right away. So another one for the females, you have the tubal ligation. So the fallopian tube is tied, here, as you can see. It's what the operation looks like. It's performed after menstruation and before ovulation. It's done through small incision under the woman's umbilicus and here, it's tied here. It's either banded or clipped, tied and cut or cauterized. Blocking to inhibit the passage of the. This one, it blocks the ova, the egg cell naman. Okay. So artificial and natural methods are effective when used correctly. With incorrect use, unprotected intercourse takes place, which gives way to pregnancy. So you still have to really know how to use these contraceptions, and there are levels of effectivity. So you have to study and really plan with your partner and with a counsel on how what is the effective method for you. Okay. So in summary, we have discussed the concept related to the sexual self. We described the development of primary and secondary sex characteristics. We discussed the operations of the reproductive system. We also elucidated about sexual pleasures and the erogenous zones. We illuminated about the human sexual response cycle and the chemistries of intimacy or love. And we familiarize about sexually transmitted diseases and their prevention, reproductive health, as well as methods of contraception. So all in all, that's our discussion. So I hope you learned something. And as a parting word, I would like you to really study your sexuality and be careful of our health as well in the world right now with the social media and liberty with our social partners is already tolerated. We have to be very careful with the choices that we make. And you as adolescents, you are the future of the country, future of the world, your humanity. You have to make your decisions very carefully. As such, I end this presentation. See you next meeting. Thank you very much.